So I want to thank everyone who's now logged on to the USU, University of Idaho, and University of Wyoming webinar, Sheep and Goat webinar series. Today we have the pleasure of hearing from Jessica Shanks, who is the current Sheep and Goat Extension Specialist in Tennessee. She grew up in Lenoir, I hope I pronounced it right, Lenoir City, Tennessee, southwest of Knoxville, Tennessee. She raises Southdown, Dorper, and Black-faced cross sheep with her husband and daughter, and primarily sells to 4-H or FFA youth and other breeders in her area, as well as selling quite a bit of lamb product. She attended Knoxville, University of Tennessee in Knoxville, and received her bachelor's and her master's in animal science. Her master's was focused primarily in reproduction, physiology, specifically with sperm quality and embryo development. Today we have the pleasure of hearing her give a talk about lambing and kidding management, and we look forward to hearing from her. After the presentation that Jesse will give, we'll go into more of an open discussion forum and allow participants to ask questions, which we will then answer between the three of us. Carmen Wilmore, who is our University of Idaho goat extension specialist, and then also myself and Jesse. Melinda, who is our normal day-to-day host for this webinar, may have to leave for another appointment, but we should be able to conduct the round meeting to answer questions afterwards. So with that, Jesse, thank you for joining us, and we'll let you take it away.
All right, awesome. Thank you so much, Chad. And thank you to the panelists all for inviting me to speak. I'm very excited to get to talk to you about lambing and kidding management today. And as Chad said, just feel free to ask questions via the format that he suggested. So this is a topic that we talk about a lot here in Tennessee, either with our producers, sheep, goat, commercial, purebred. We talk a lot about lambing and kidding management. So I thought this was a good topic to breach with you all. And so some of this first stuff we might gloss over just a little bit because you know, we all know when an animal is going to lamb or kid, right? Or we know the impending signs of lambing and kidding, even if we don't know precisely that it's going to happen within the hour. But what I've got here are some pictures. You know, obviously, if membranes are present, we see feet, we see a head, you know, obvious discomfort from that female or anything like that. And we know that she's pregnant, has a large udder, as we can see in this picture on the right. We know that, you know, lambing or kidding is going to happen soon. So my advice to people, if, you know, you're not really sure, I deal with a lot of beginning farmers in Tennessee. Our sheep and goat industry is really, it's growing. So I try to, you know, give some beginning information as well as, you know, information for old timers as well. But you can look at the vulva of the female and kind of tell that she's getting ready to lamb or kid. It's going to be swollen. Most likely it'll be red. If she has a light colored vulva, you might see some discharge, some mucus. It should be very open and relaxed, and that's due to several hormones that are interacting and causing everything back there, you know, in her pelvis to open up and get ready for a lamb or a kid. We look at the udder. Is it enlarged? You know, obviously some milk letdown has occurred. And then these various other signs and symptoms. Like Chad said, I raise Southdowns and Dorpers. And I don't know if you guys notice this a lot, but I have barn cameras on my sheep, and they're in the barn to lamb, and I'll see them digging constantly, you know, before they're getting ready to lamb. And you think they're going to dig a hole in the ground and go to China, but usually they'll have a lamb before that happens. Some more signs of lambing, kidding, obviously membranes present, legs, feet, head, etc. Some blood and discharge. I always tell my students in sheep and goat production, lambing and kidding is not, it's not a clean process. It could be, lots of blood, lots of fluids. It really just depends on the individual female. So I want all of you to remember or to learn that parturition occurs in 3 stages, right? So that first stage is preparation for labor. And a lot of us may not recognize this, especially in ewes that and does that have done this before. This is the stage where her uterus and her cervix and everything else is preparing to deliver that lamb or that kid. She'll be having some contractions at this point from her uterus, but it's all just to prepare the lamb, get it in the right position, get that kid up and, almost to the birth canal. But it's the first stage and it can last for 2 to 12 hours. Some females will eat during this time. They'll act normal. You won't know anything's happening. And then an hour later, they might go directly into stage 2 and have a lamb. But make no mistake, their uterus has been preparing for that. So really just depends on the female and her level of experience. The second stage is the rupture of those fetal membranes and then the expulsion of the fetus. I have on here that it takes 15 minutes, but most of us know that it can take up to 2 hours, for that lamb or that kid to come out. And we're going to talk a little bit about dystocia here in a few slides. But this is mainly stage 2, the fetal membranes rupture, and then that lamb or that kid comes out into the world. The third stage is actually passage of the placenta. And I always tell my students this. I teach sheep and goat production here at UT, and they say, well, that doesn't have anything to do with, lambing or kidding, but it has everything to do with it, right? Because once that placenta has done its job, it needs to come out. And ruminants are unique in the fact that, they're not like horses, right? They don't have to expel that placenta within a few hours or, dire consequences are going to happen. But we still want that placenta to come out within a reasonable amount of time. I told producers not to worry, until it's 12 to 24 hours past. And then you kind of need to start thinking about, well, how is it going to come out? Do I need to contact my veterinarian? Do I need to do something to intervene? I always tell producers, do not reach in and pull that placenta out. It's very tempting because you might have, a piece of that placenta hanging out or more. And you say, well, if I could just reach in there and, scoop it out. But if you do that, you're damaging the maternal caruncles that are in there. So that placenta is actually attached onto her uterine wall. And if we're in there digging around and, scraping and pulling before it's ready to release, you're damaging the lining of her uterus. So don't do that. Don't pull it out. It will come out on its own time. Maybe not within an hour like you want, but it will come out eventually. Now, dystocia, and I'm sure a lot of you have had either experience with this or you've heard of people having dystocia with their animals. I tell my students in some of the lower level animal science classes that I help guest lecture in, I'll say, how many of you have helped with a birth of a lamb or a kid or a calf? And they're all like, oh, me, I got to pull a calf and it was awesome. And it is cool when you get to pull a lamb or a kid and it comes out fine and mom and baby are fine. But me personally, I like for lambs to be there when I get to the barn, right? I watched them come out, maybe on my barn camera or whatever, but I want them to come out on their own. If they do not come out on their own, we call this dystocia. It's a difficult birth. And it can be caused by several things, right? It can be caused by high birth weights. Some of our clubland producers and commercial producers, maybe that, or commercial ewe producers, I should say. Here in Tennessee, we've got commercial ewes and market lambs. So not a commercial producer, like I misspoke, but the ones that develop show lambs, they're looking at, more muscling and using a different buck via AI, and they can run into high birth weights and a big head or really large shoulders to actually pass through that birth canal. We all know that the number of fetuses can make a big difference in in how these lambs get out, right? Because if you've got triplets, there's going to be a traffic jam. You know, one foot might be trying to come out while somebody's head is trying to come out. And it usually does not result in a successful outcome if the ewe or the doe is left to her own devices. So some other things to consider are the size of that ewe or doe. You know, if it's a first time lammer and you bred her to a larger buck or ram, you could have issues with dystocia. And then another thing we'll touch on is ringworm. I don't know how frequent that is for people that are on this webinar, but it's a frustrating situation that we in Tennessee run into, you know, fairly frequently. This is the ringworm, is the failure of that last cervical ring to dilate. Sometimes most of the cervix won't dilate, and it's usually not responsive to drugs or manipulation via your hands. And when I say it won't dilate, I say, you know, you've got a hole about this big. I don't know if you can see it on there, but just 1.5 inches or so in diameter, and you can't get more than 1 or 2 fingers through it. And it will not move. It won't do anything. That's what we consider to be ringworm. And it literally feels like somebody's wedding band that you can't get through. A lot of times a C-section is your only option. I personally have tried to manipulate cervixes before, and it typically doesn't work out in my favor. So I have a great vet that I work with. I work with several of those type people, and usually we'll do a C-section just to get that lamb out and to save the ewe. It usually happens in ewe lambs, younger females that haven't lambed before. It is not documented in goats. So goat people, count your blessings that you don't have ringworm that's going to happen in your barn. They might not dilate for other reasons, but not due to this. And a lot of times people will say that it has genetic and nutrition influences, maybe mineral imbalances or mineral deficiencies can cause this, but I don't think we have our finger right there on why ringworm happens. But again, highly frustrating situation. So if you ever reach in and you just feel a band of tissue about as big as my hand here, you could be dealing with that. Some other things to consider when we're looking at dystocia. How is that lamb positioned? You know, is it normal? Is it backwards? Is it breech? Sometimes their elbows can get locked back, and then you've got to actually, you know, push the body of the lamb back in and get its legs up. There's several positions that we can see. Another one that's very common is when the legs are back. You've just got a head and one leg coming through the birth canal, and another leg, you can see it's there, you can feel it, but it's all the way back. So you've got to manipulate that leg to come up and get in the birth canal. Another such thing that happens a lot is a swollen head. If that lamb or kid has been in the birth canal for too long and their legs are not out where they should be, they're probably both back, and that head will get swollen because of, you know, circulation issues. But what happens there, that lamb or that kid could become, you know, anoxic for a period of time. So that requires quick correction. This is a picture of normal position. We've got a lamb here, its head, whoops, I'm accidentally switching slides on you. We've got a normal position here. The head is up, legs are up, and you want them to look like they're coming off a diving board, essentially, to come out. So that is normal. Here's normal in a goat, just a little bit different picture there. But that's what we want to see happen. Some positional barriers, and we'll talk through these a little bit. You know, when both feet are back, obviously you've got to push the head back in and get both feet out. And a lot of people tell me, you know, here in Tennessee, we have a shortage of large animal veterinarians. I'm sure that you guys deal with that as well, you know, out where you are, but we don't have a lot of vets that will go out to a farm. And so we kind of have to, I give some advice over the phone and say, hey, call your vet. And, you know, they say, well, I can't do that. So I have helped a few people over the phone with things like this. But in this case, you want to push the head back and get both of these legs out without ripping the uterus or you know, without keeping that lamb back in there too long. This one on the right, 1 foot back, that's usually an easy fix, and you can reach in there and grab that other foot. Head back, same thing. You've got to, I like to hold the legs and try to get my hand above them and then go in here and get the lamb or the kid by the back of the head and pull that head up and into the birth canal. And it can be a workout when you're trying to do this. Breech, this one on the right, the butt is in the birth canal. This is a problem because we can't get this out. They're not going to come out like that. So in this case, I always advise, I teach my students too, you push the butt forward and you get the back legs out, and then you pull the lamb out. Most all of my students, they try to say, well, I would push it all back in and then try to get it out by the head and the front legs, because that's normal position. And that would be great, but the more time you're in there, the more difficult you're going to have with that lamb's recovery, and you may not get it turned around, especially if there's twins. So I like to push these hips forward, get both back legs up and out, and then be prepared to, clean that lamb's face, clean that kid's face, and make sure they don't aspirate a bunch of, contents from the uterus. Here we have twins. They can be in all kinds of positions, twins and triplets. Here's a leg and a head, legs and head coming out from one, and then the legs of another. Her uterus, once it gets in position to push, she's going to start contracting and dilating her cervix, and whatever's there is going to get pushed out eventually. So it may not come out all the way if it's in a position such as this. So all kinds of different positions that these things can get in. How to know? The best way is to stick your hand in, wash and clean the vulva if you can. Sometimes, there's not time to do that, but I always recommend that people use gloves and use plenty of lube, preferably clean lube. There's several different brands you can buy. It's fairly cheap, and always wear gloves if you can. There's lots of zoonotic diseases that you can get from sheep and goats. And if you're a pregnant female, most certainly you have to have gloves on, or I would say, if possible, don't even try to deliver a lamb or kid, just because the risk to you and the fetus is fairly high if there is a pathogen present. But you want to determine if that lamb is right there up in the birth canal, and you want to determine the position it's in. And what I teach students to do and producers, so you go in and obviously you can't see, right? You're kind of going into a black trash bag. But once you go in, remember what lamb or kid anatomy should look like. So you're feeling its head, you're feeling its shoulder blades. You can feel that a front leg has a knee. You can feel that a back leg has a hock, and you can really use your hands to create a picture. That does take practice to really figure out how best to do that. But this is one of the better ways to figure out, what position it's in, obviously, is to just get in there and figure it out. I do recommend you keep your fingernails trimmed if possible, if you're, lambing and kidding heavily, because 9 times out of 10, you're going to have to go in a sheep. And if you've got really long fingernails, of course, that's probably not going to feel very good. And it will inhibit your ability to feel things. Also, remove any jewelry. Take your watch off, take your rings off. Make sure none of that is going to hurt her in any way. When you're looking at correcting a dystocia, I always like to tell my students, hold on to what you have. And that can be difficult, right? Because if a lamb is alive, and hopefully it is, if we're pulling it, we got there in time. Sometimes you've got to hold a leg outside the body or 2 legs and reach back in and get the head. So hold on to what you have and try to get that lamb out in the best position possible, realizing that you may not ever get it out in normal position. Backwards is okay if you have to, things like that. I have used a piece of twine before, or a piece of like a lambing chain, think calving chain, something like that, or, another item. Usually I'll clean those in some Novosan and slip it maybe around the back of the lamb's head and into its mouth, so it can't, strangle it, but it's in its mouth. It gives me an extra hand to hold something to make sure I get that lamb out. You can also slip it over their pasterns and use those. Use a rope or chains to hold that. out while maybe you go back in and get the head, or, you know, whatever else needs to come out. It is possible when you're doing this to pull too hard. I usually try to pull when the U is helping me with a contraction. Sometimes though, during dystocia, you're at the point where that U or that doe is worn out, right? They're not pushing a lot. So help is not always readily available in the form of that female, but just be careful and try not to pull too hard, but also recognize that, fetuses and, you know, lambs and kits, they're very resilient, more so than we think. Colostrum, this is essential if you're going to have a successful lambing or kidding season. I always try to keep colostrum on hand, either frozen from my own flock, or as a last ditch effort, a commercially available supplement. We all know what colostrum is. It's that first milk that the female produces. It's got fat in it, protein, antibodies needed by the neonate. And the order of preference, if you had to make a decision, obviously from its own dam, the own mother is preferable, but you can also use frozen colostrum, or from someone in the same flock, or if you have another ewe that has just lambed, you can steal some from her. Just recognize and try not to take, obviously too much. You can also use fresh or frozen from a neighbor's flock or from other species, but realize with that, you could be introducing some things, some pathogens that can come through milk. So be careful with that. Commercial supplements also, it's best to have these on hand, and make sure you're using Colostrum Replacer, not the colostrum supplement. There's several different brands of that, and they're a replacer or they're a supplement. So make sure you're using a replacer. This has to be given within those first 12 hours of life. The earlier, the better, because their digestive system is going to get more selective later on. And if we were to give a 3-day-old lamb, colostrum, it would probably just give it diarrhea. It wouldn't be able to digest it, the way it needs to be, and still be able to give them some immunity. Tube feeding. I don't know if this is a skill that most of you have used before, or you're just wanting to learn about it. I will say that it is a lot easier than it seems. The first time I tubed a lamb, I thought, oh my gosh, I'm gonna drown it in milk. I'm gonna get down the trachea. This, that, and the other is going to happen. But once I did a few, it made sense to me, and now I could probably do it half asleep. So it is an essential skill that you can use. And the reason we tube an animal is they're born via dystocia, and they're really weak and unable to get up and nurse on their own. Maybe we found them and they were very cold. They can be too cold to tube feed, so we'll talk about that in a second, but they just need some help. Or maybe the ewe or the doe has died and we can't let the lamb or the kid nurse. So there's reasons to tube and reasons not to tube sometimes. You've got to make sure that animal is warm enough. I like to tell producers to feel its mouth. You can take its rectal temperature, but they've got to be warm enough to make sure that they're going to be able to absorb that milk. They also need to be able to hold their head up, right? So you don't want to tube it and then leave it laying there on its side to fend for itself, and it could aspirate milk if that were the case. You want them to be able to sit up, on their sternum with their legs under them, and be able to hold that milk where it needs to stay. Also, never microwave colostrum. If you microwave it, the milk can get too hot and cause a chemical reaction to damage the proteins that are in the milk. So I always like to thaw colostrum in a warm water bath. I realize this takes time. You're frustrated, you're trying to hurry. But if you can do it in a warm water bath, that'll be a lot better. I like to use a 60 cc syringe with a slip tip on the end, not the lure lock, because I'm going to slip a tube onto it. I like polyethylene tubes. There's several different types of tubes, but the red tube that is, it's slick when you feel it. It does really well, because if it's a latex tube, it can get flimsy when you're trying to thread it down their esophagus. So that can be difficult. And then obviously colostrum is needed. I won't go through all of this in great detail here, but I've got a picture here. So this is how I like to hold lambs, or I will be in the lambing jug or beside them in a pen. And I like to thread the tube down the right side of their mouth. And if you look at how long that tube is in this picture, once you're into about here, you're in the right spot. Now, if it's halfway out and you think, oh, I can just pour the milk in and it'll be fine, you may not be in the right spot. So just be sure you've got it in there enough. And what I like to do, I will thread this down and feel over here on the right side and make sure I'm in the esophagus. And then I will put this tube on the end, or the syringe on the end, and I'll listen in it and make sure that I hear some gurgling, some noises in there, and not, breath trying to come back out at me. People think it's easy to go down the trachea. Excuse me. I found it, hard in some cases. Luckily, I haven't had that happen, but you do want to check and make sure you're in the esophagus and not the trachea, to make sure you get the milk in the right spot. Another thing, when you're tube feeding, I only feed a small amount just to make sure it goes in, right? So I'll feed about 2 ounces. I'll make sure it goes down the tube and, into the lamb. And then I might feed another 2 ounces. You're not going to feed 8 ounces at once to a newborn lamb or kid. And I don't like to dump a lot in that tube, because if you do that and you're stuck there and maybe there's a clump in it or whatever, it's not going to go in good. So then you're going to have to pull the tube off or pull the syringe off, make sure milk doesn't, get in the lamb's nose or anything. And it just creates a difficult situation. So I like to pour a little bit in first. And then once I'm sure everything is flowing, it's in the right spot, I'll pour some more in. A newborn needs 10% of its body weight in colostrum to start its life out, on the right foot. Hopefully, like we said, between those first 12 hours, first 24 hours is okay, but earlier is even better. And make sure that lamb stays warm, place it under a heat lamp, put it next to the ewe or the doe. And then I always tell people to wash all of your equipment thoroughly. There's nothing worse than you're at the barn, maybe it's away from your house, and you've got the tube and the syringe, but it's nasty, right? And it's cold, and you don't have a place to wash it really well. So make sure it's clean after each use. I think we're right on time here, just about, for questions. So with that, I'll take any questions about lambing, kidding management, or anything else you'd like to ask me.
Thank you, Jesse. That was informative, and I enjoyed some of the pictures and hearing your experience. We do have quite a few questions starting to ramp up. So we'll start into some of those. So one of them that came was about timing around parturition. Mm-hmm. And so what can you kind of explain that timing sequence again of, how long after the water bag appears should, that you be able to give birth before assistance, or once the nose of that lamb is out, maybe how long you should wait before you start giving assistance? Absolutely.
That is a great question. And normally I cover that during my, I tend to ramble sometimes when I lecture, but so that's a great question. I tell producers and I tell my students, I use a rule of thumb of about 30 minutes before I will intervene. And let me explain. So if I see a ewe that's in active labor, she's got maybe a nose and 2 feet out, a water bag, anything like that, I will sit and watch her. And, some ewes, I have dorpers, like I told you, some of them I'll be in the barn watching them, and they'll look at me like, what are you doing in here? You're not supposed to watch me do this. So I might have to watch her on the camera or something, but watch and make sure that she is actively progressing. So for 30 minutes, if I watch her and she keeps pushing more and more of that lamb out and she's making progress, I'm not going to intervene until I see that, wow, she can't get those hips out or the shoulder. If in 15 minutes I see that she's really working hard, pushing hard, breathing heavy, all of the above, and I just see a water bag, then I'm going to intervene, quicker. So 30 minutes is a good rule of thumb before you help, but that varies by, what the ewe is doing. If she's laying there not doing anything for 30 minutes, I may still go ahead and just check and make sure that, nothing's wrong. I have had ewes before, they'll have a lamb in the birth canal and they'll just be laying there like, this is too big. I'm not pushing anymore. You're going to do this for me. So she may not be laying there pushing, but if I put my hand in, I feel a nose and legs and a live lamb, I've got to get it out. But very good question. So I usually wait about 30 minutes and make sure that they need help or they don't need help. One thing I will say, in my own experience, I have always regretted not intervening quick enough. I have never gone in and helped a ewe and said, man, I should have let her do this on her own. There's no problem. Usually, your own sheep. So if I feel like I need to intervene, I'm going to do it rather than, wait and second guess myself.
That was great. So it looks like the questions are starting to roll in. Okay. So, and Carmen, I believe this is kind of the portion of the webinar where if you want to, feel free to jump in on any of your thoughts, and I'll do the same also, Jesse, if that's okay.
Okay, yeah.
But so we had a couple of questions based around the placenta and also the placental fluid. Mm-hmm. So one referring to maybe color differences of placental fluid. What could be some possible causes of the differences in color? And also, should we be allowing our does and our ewes to eat those placentas after birth?
So good questions. The color, I'll touch on that one first. So if, and I have had this happen before multiple times with my Southdowns, especially because they've got white fleece and they'll come out covered, in dark yellow. Most of the time that is meconium. That's that first poop basically that the lamb has. And usually it's because they've been under a bit of stress. Being born is not an event that is without stress. So what happens is they're stressed in there, they're starting to defecate on themselves, and that meconium, that first poop that they have, is coming out, and that's getting in the fluid, and they basically look like they've taken a bath in it when they're born. And sometimes they're just covered in that stuff. Obviously red, other things like that, that's from blood. And the next part of the question, should we let them eat it? So in most cases, I have not been successful in preventing a ewe from eating her own placenta, unless I just take it away from her. Obviously, I don't have many ewes that will eat their placenta. We certainly don't want to allow other ewes that haven't lambed yet to eat that placenta, because, that's how pathogens can be, transmitted. Obviously, if they're in the same pen together, if it's Campylobacter or something like that, they both, could be at risk for that. But there's nothing wrong with letting them eat their own placenta necessarily. Yes, it's disgusting. It's gross. It's not something you want to witness and watch because they chew it, and but it's not really going to hurt them, at least in my experience and my knowledge.
Did you want to add to that at all, Carmen?
Sure. I think in our experience, the only time I've had issues is like some ewes will try and eat, or I guess I don't have sheep, so it's does in my case. They will try and eat the placenta, and they can, if they are trying to swallow it whole, they can almost choke on it. So I've had a couple, they've not choked to the point of like not being able to breathe, but it is one of the things we get concerned about. So usually after it drops out, we just pull it out of the pen and we don't have to worry about it.
Mm-hmm. That's a good point too. I take mine out. I don't leave it there for them to eat. Another thing, Carmen, you mentioned they choke on it. I have had some ewes that they'll start eating the placenta around the lamb, like it's laying there with it, and they will chew the tail of the lamb too much. And I have had a few ewes eat the tail of the lamb down to about the nub before I can really, intervene. So maybe it is a bad thing to let them eat the placenta if you see it in the pen, definitely remove it.
Yep, that's what we do. That's what we do as well. It's just a biosecurity thing. And then we've seen that as well. So for with the goats, they don't necessarily chew the tail, but they will pull and chew on the umbilical cord. And so we trim those pretty quickly, and we trim them, not up against the body, but like within an inch, just so that they're not pulling on them. Because I have had some like pull on that in their cleaning of the kids, and I get concerned they're gonna cause like a hernia or something.
Definitely.
Well, great. I think I concur with a lot of things you guys are saying. And, when we think about wildlife, a lot of our, large ruminant wildlife that do that as, maybe to deter predation, right? So, predators that may go out looking for those things. But as far as our livestock species, even though they can, it's not always optimal by some of the reasons that you're saying, right? So a lot of the questions that are coming in, I'm going to try to have us answer them in a logical order. So we'll kind of go with around the birthing process, and then answer some of the ones about management post lambing. So one of the questions we had is based around multiples, twins or triplets. What are some of the things that may cause a fully developed fetus that didn't make it, and then also a lamb that made it in the same litter? And so Carmen, on our last webinar, you actually gave you talked about this same issue a little bit, right? So
yeah, I'll be interested what Jesse has to say, because I think what this person is asking is something I've experienced as well, where we've had it happen in quads where 2 of the fetuses never fully developed and started decomposing in utero. And then you have 2 live, healthy, kids or lambs. So that's kind of, I would be interested to see what other people think, because I have not figured out what's happening when that happens to us either.
I've had that happen as well too, Carmen. Just last year, in fact, I had a set of twin Dorper lambs, and the first one that came out was tiny. I mean, the Dorpers I have they're not small Dorpers, they're normal. And this lamb could have fit in a takeout box. She was so small. She was fully formed though. She was fully formed. I still have her actually. We kept her as a replacement because she grew out really well. But right next to her, there was a fetus it was still, in some membranes, not fully developed. I would venture to guess not past 30 days. Definitely some early loss there. It had not decomposed though, it didn't smell or anything. It was just like a little ball of tissue essentially. And we haven't really had that happen frequently. But I wonder if things like, I don't know if you guys are familiar with Cache Valley virus out in your area. We've had more of that happen in Tennessee. And, it's interesting because if you look online, they're like, no, it's only in the Western states and it's not in the Eastern states. And it is here. I've had it in my own flock. I think sometimes, and that can affect one lamb and not another. It just depends on, how it was infected and that type of thing. And, if that lamb during early embryo development, if something went wrong, obviously, if there's no bacteria present or anything, that one could be arrested in development and stay in the uterus. And then while the other lamb, since they're not going to share, they're probably not sharing a placenta, they're going to develop just fine. Where we get issues is if, they're decomposing in there and they're smelly, there's pus present or, whatever, but we have had that happen before. I don't have a lengthy scientific explanation for it other than, one made it, one didn't, and they aren't sharing a placenta at that point. So as long as the other one's placenta is intact, good circulation, all that good stuff, it shouldn't affect the other one. But I have had that happen before.
Yeah, and that's similar to what we've experienced. And I would say every time it's happened, the ones they're in separate placentas, and so they have their own environment. We've had one where there was, it was really weird. They had a cord wrapped around the leg of one of the triplets in a sack of 3. And so the one with the cord wrapped around its leg, it, that cut off circulation to that kid. And so that kid had died. It had formed almost, they were kind of preemie. So she kidded 2 weeks before her date. And so that one was dead. The other one was, but they were like formed, but it just had this deformed leg. And like when it came out, it was completely wrapped with that cord. And we did have one live kid. It didn't survive because it was so premature. But it did breathe for a little while. And so it was kind of weird because they were all together and it never really decomposed. I think it just finally that signal from it to the doe, through that cord of like, this isn't alive anymore. And then she went into labor and had all 3 of them. So
yeah.
Great. So there are a number of questions that I think are all related that I think we could try to answer in one swoop. So based around colostrum and then also tubing again. Okay. So I guess with this, one of the questions is how long will ewes produce colostrum for? And then also, can you discuss again a little bit about the tubing technique and the material of the tube, how to go about doing that, making sure you're cutting it to the right size. So maybe you might want to even refer back to the slide that you had on before, Jesse.
Yeah, let me go back to that now if it'll let me click.
And then if you, as educators, we really don't promote certain brands. So there is a question on what brand of powdered colostrum or replacer do you recommend? And I think generally, I've gone through and made tables of the nutrient content of a lot of different, milk replacers or powdered colostrum. And in my opinion, as long as you're staying species specific, you're better off in that way. And the real stuff, obviously, if you can get it from a ewe on your operation, is better than buying a powdered product, I think. But species specific is kind of the name of the game, I think, when it comes to that. So
definitely. And another point on that, Chad, it needs to be available to you. If it's something that you have to order and it's back ordered and it takes 3 days to get to you, I like to have 3 or 4 bags of it on hand, and they're not big bags. They're, pouches usually, the ones I order, but as long as it's available to you, and like Chad said, species specific, don't try to get something that's that you've got to order every time. If your local farm supply store has it, that's awesome. And we say this in feeding.
Sorry, we had a technical difficulties. We'll give it a couple minutes for everybody that was on to get back on. It seems like most people figured it out, so we'll just hang out for a minute. I think it knocked us all off. So I just asked people to put their questions back in. But I think we're talking about colostrum replacer.
Yes, and tubing.
Yep.
Yep. It won't let me share my screen.
I think, okay, here we go. We should have it now.
There we go. Okay, not that one. Yes, so we were talking about tube feeding and getting that. Let's see, I clicked over here. So again, whatever colostrum replacer you can get that is available to you, easy to obtain. And the tube I was mentioning, so there's latex tubes, and when you feel them, they're kind of soft and squishy. And then there's a red polyethylene tube. And like Chad said, we don't recommend brands, but one place I have been able to find this is at Louisville in the Mid-States Wool Growers booth. So that's one place I have found them, not recommending that specific person. but just make sure it's that material. If it's latex, that's fine. But if it's really warm, the tube will be a little flimsy for you to get down into the trachea. And what I try to do, like I said, I'll have the lamb's head facing away from me, and I feed it down the right side of its mouth. I don't think it necessarily matters which side, but I'm right-handed, so I just feed it down into its esophagus. And like I said, I believe it's harder to get into the trachea than what people would have you believe. But gently feed it down there, and I'll even put it back in the lamb's throat and see them swallowing. And I know that I'm in that right spot to go down the esophagus. And then, like we mentioned earlier, just get it in place. And I always listen into the tube. Again, not highly scientific, but I'll listen in there and make sure that I hear some gurgling, little noises that you should hear from their little stomachs. And then I can go ahead with some milk and get them tube fed properly.
Yeah, I agree, Jesse. One thing I do a lot is wait for them to start that swallowing motion. And I feel like with that little trick, oftentimes you won't run into many issues. And if you do start going down the wrong tube, generally it is very uncomfortable for the lamb, and they'll let you know pretty fast. So, okay, well, maybe it may be easier to kind of go, now that we have both new and old questions back on. Again, we apologize to our listeners that things kind of cut out for a second, but we're thankful for those of you who got back on to listen to Jesse. One of them was asking about how to revive lambs and or kids that come out and are lethargic or having trouble breathing after lambing. What are some recommendations that you would give there?
So usually when they're, having trouble breathing, it depends on why they're having trouble breathing, right? So if it's a premature lamb or kid that is, obviously their lungs aren't going to be as developed as they need to be. And for a situation like that, your only success is typically going to be some supplemental oxygen. And that's something you're going to get at the vet, and probably in their hospital. Otherwise, what I like to do, normally we can't, like out on the farm, we don't have the equipment to, put a tube in and let them, breathe through artificial means or anything like that. But if it's an upper airway issue, I like to have a bulb that you would suck out a baby's nose with. I like to use that to suck their nose out and get all that mucus out. But if they're really having trouble breathing, that can be very difficult to correct. If it's not just like an obstruction, that's in that upper respiratory way. I don't know, Carmen, if you have any other suggestions for that, but it can be really hard to get one that's not breathing very well to correct that to where they're going to thrive.
Yeah, I think if they've just been born and they just are having a hard time, we try and set them, upright, and we don't hang them upside down and all that kind of stuff people say. We just set them upright so that their lungs can fully expand is what I always try and do. But yeah, it's hard. That's a hard one because there's not a lot of stuff you have on hand to do much. And I've had people like blow in their mouth, and then sometimes you just inflate their belly with air. You don't really get it in their lungs. Yeah, you can put the straw in their nose, and there is that acupuncture point. I see that in the comments. There's a vet, a retired extension vet here, and he had a really good diagram of where that is, but he only had it on a baby calf, so I don't know if he has it drawn out for lambs and kids or not. That would be interesting if I could get that from him.
Mm-hmm. Definitely.
So I think some things got, it became difficult to know if some answers got questions based around the colostrum. Did we mention how long that colostrum is being produced by that ewe, and also the reference of sharing it with others in the flock if they're rejected or whatnot?
Yeah, so no, we didn't talk about that. I am not a mammary gland specialist by any means, but colostrum is produced during that last little bit of pregnancy, you know, days, weeks, or probably not more than a week, but it's produced there, and it's basically waiting, you know, on that lamb to be born. And once it has been removed, then their milk starts to come in, the actual milk, and you can see where it changes consistency. Colostrum is going to be thick and yellowish, depending on the ewe, of course. And then after that, she's not going to produce colostrum anymore. Sure, there's probably some antibodies left over in the milk, but she's not going to produce it once that lamb has been born and you've used that colostrum. Using colostrum from another ewe or another doe in that same flock is perfectly okay. Obviously, if one had, you know, some type of pathogen that you weren't aware of, you could transfer that to the lamb or the kid. But realize that without colostrum, then they will get no immunity. So it's one of those things, you're darned if you do, darned if you don't. So yes, it's perfectly okay to share within flocks. The only thing I would caution people on is using it from a different flock. Maybe you don't know the health status of that flock, or using it from a dairy, a cow dairy. You don't know potentially what could be in that colostrum, or if it's high quality or anything like that. So, but yes, you can share within the same flock. I do it all the time. And if one rejects a lamb, or, you know, if the ewe, if her lambs die, I will take that colostrum and save it and freeze it. I saw someone in the chat box commented freezing it in ice cubes. Very good tip. I like to use breast milk bags for human babies, because you can measure how much is in there, and then you lay it flat in the freezer. So it's very thin, and they're usually cheap. You can buy them at, you can buy off-brand at the store, and there's usually 50 to 100 bags, way more than you'll need in a lambing or kidding season. But they store nicely in the freezer, and then you can put them in a cup of warm water. And then as they thaw, you see, oh, I've got 4 ounces or 6 ounces or whatever. So I really do like those too, to freeze colostrum in.
That's a great idea. How long can we keep that colostrum frozen?
I don't know if there's a scientific answer for that, Chad, but I usually try not to keep it more than, like, I'll have some colostrum from last year just in my freezer, but I realize that it probably decreases in quality over time. And with the freeze thaw process of some freezers, we know that it's probably not optimal, but I usually try to use all of mine within the same lambing season, just to make sure that it's as high quality as I can get.
Yep. Yeah,
But-
I completely
But
agree.
colostrum from last year is better than no colostrum at all.
Mm-hmm. Yep.
Yeah, we keep ours for about a year and then try and replenish it every year.
Mhm.
And there's been I think those questions come in a couple times about the temperature to heat colostrum too, and that it should be heated to 103. And also, if the kid had any hardships, they should also be at 101 before you feed them. You don't feed milk to a cold kid or lamb.
Mhm. Yes.
It looks like there are quite a few questions on large lambs, and then also some dystocia questions. Most of them based around the head being turned around, and getting that head to turn back in place. But first, let's try to answer some of those questions based around large lambs. One of them being, is there breed differences in and let me refer to the question. I apologize. I'm combining a couple questions to see if we can get so breed differences in gestation length, and also with ram specific breed types. Is there information that we can find things on this?
I don't have any information readily available that I could point them towards, but yes, there are differences in breed types as far as gestation goes. So remember, the lamb is the one, or the kid is the one that determines when birth is about to happen. Contrary to popular belief, it's not the pregnant woman or the pregnant you that says, I'm tired of being pregnant, I'm gonna, kick this baby out. It is the lamb that gets stressed and says, man, I don't have enough room in here. I was on a beach, relaxing, and now I'm, cramped up in a box. And so they go through a series of hormonal changes. Her placenta is involved in this, the ovaries, all that good stuff, her uterus. And then the lamb starts that process of, oh, I've got uterine contractions going on now. So if that lamb is bigger, let's say you bred a big blackface ram to a small South Down ewe, obviously they're probably not going to make it. Even a big single is not going to make it to 148 days of gestation. She might make it to 142 or something like that. But once that lamb signals that it's uncomfortable, it's stressed, its cortisol levels go up, that's when it's time to be born. So certainly there are breed differences, and we don't have EPDs like we do in cattle, right? To the extent of we don't have, lambing ease and lamb weight or birthing weight, that type of thing necessarily for all of our breeds. So there's probably limited information out there, and a lot of it is due to experience. One of the things that I caution people on, especially with greater use of artificial insemination, at least here in our area, people are using all these big, club lamb bucks, and they're saying, oh, well, he's got his shoulders nice and this and that. But if you're putting him on ewes, you don't see him in person, you just see him in a semen straw. You're putting him on ewes that could have difficulty having his lambs. So just because it goes in with a semen straw and not a 200-pound buck breeding her, you could still have birth difficulty if that lamb is too big.
Yeah, and I just wanted to comment on the gestation length also. We also need to realize that the day we put that buck in, on any given day that those ewes are bred, calculated out that 5 months or 121 days, which is the average across a lot of different sheep breeds that we have, that you can have that lamb generally a week or before or after that calculated date. And so when we're getting ready for our lambing season, we should have things set up at least a week beforehand, if not sooner, in my opinion.
Absolutely.
So, and that's beyond breed. It's just kind of what happens as far as reproductive physiology.
Good point.
So, Carmen, are you looking at some of these questions? So I just want to remind our audience, we're going to try to get to as many questions as these can. As they keep rolling in, it's hard to answer every single one of them. So we're trying to prioritize some of the most common type of questions, but we will try to get through as many as we can.
I can take the Madigan squeeze question, and then maybe Jessie could chime in if she's got experience with it, because we did talk about this last month, because I did use this on a few of our kid goats, and I wouldn't say that you can revive anything, but you can, if they're having problems with like standing up and finding where to nurse, and having they're just kind of dumpy and weak, things like that, you can do the Madigan squeeze, and that can help kind of send those signals to get things going again in their brain, really. But as far as reviving something, I don't think it's not really used for that. It's used more to help them kind of initiate how to stand and how to nurse and how to kind of get out of a funk. I don't know what the best word for that, but when they're really lethargic and having those problems, it can help move it after the point of them not breathing or having a really low temperature, it's not going to do those things for them.
Mhm. I agree with that, Carmen, definitely.
Okay.
Let's talk a little bit about lamb processing afterwards, as far as umbilical cord care, and what are maybe some appropriate things to do with the umbilical cord.
Yeah, so you all chime in with any tips you have, but I have found I don't like to cut the umbilical cord. So what I will do, I will take it and kind of pull it. If you've ever felt an umbilical cord, it's pretty stretchy, I guess you could say. It's hard to describe, but I like to pull it because then I'm causing some hemostasis there, or causing that blood to kind of clot in the end of it. And I don't want to cut it, because then you could get a lot of blood flow out of that we don't want, right? We don't want blood pouring out of the umbilical cord. So I recommend taking it and kind of stretching it. Kind of like if you were castrating a calf and you take that spermatic cord and stretch to get it to sever. If you're going to cut or trim it, like Carmen suggested, definitely use clean scissors. And I have done that before on baby pigs, baby lambs. If that umbilical cord is, 12 inches long and it's dragging the ground, we're just inviting bacteria, to go up there into the umbilical cord. And the lamb or the ewe can step on it too and pull it and cause it to bleed a lot. So in that case, I would cut it with some clean scissors, not, sterilized in an autoclave, but wipe down with alcohol, Nolvasan, something like that. But definitely you can use scissors to do that.
Yeah, I would agree with that. If it hasn't been severed, like between the doe and the kid, I do exactly what you said. I use my finger and I kind of like pull it, because like you're saying, you don't want just a clean cut, because then it is going to bleed out more than if you cause a little bit of like trauma. Because when you think of the doe, they'll sit there and chew on it until it finally severs. And so I try and mimic that if they haven't gotten to it. And then after a while, once it's been a little bit, you can kind of tell that there's not a lot of blood going through it anymore. And then that's usually when we'll trim it so that it's not dragging on the ground. And then we always spray with an iodine solution. Yeah. An iodine solution, just to help with the biosecurity issues.
I completely agree. Do you, just kind of as reference, do you think that there's a difference between spraying iodine or dipping? Oftentimes you hear that dipping is favorable over spraying. You heard that before, Carmen?
What was that again? I was reading something.
Spraying iodine over dipping.
Oh, I like spray because that's what we, I don't know.
Just works for you guys.
Yeah, it's more convenient. I feel like then you have less stuff falling into the dip cup that you have to fish out or worry about it contaminating. Or, you're going to dip that one, then you dip the next one. Whereas the spray, you can spray it on there, and usually I don't get anything on our nozzle, because if you hold them away, then you don't get anything on it. So
I think as long as you soak it pretty well and get a good, it may take 2 or 3 sprays, I think, and around the whole thing, not just a spritz from the front. Make sure you get the whole thing. I think that's definitely adequate.
Completely coat. I agree. Can we talk about maybe helping hypothermic lambs? As we discussed, lamb death early on in life, we know that hypothermia and hypoglycemia are the 2 biggest issues we deal with that cause early death in lambs in those first 24 48 hours. How do we combat that as producers?
So several different things, I think. Like me, for example, if it's 10 degrees here, and you guys are going to laugh at me probably, here in Tennessee, cold for us is like below 25. And my lambs they're born in a barn. I have a barn camera on them. If we're at 15 to 20 degrees, I am constantly watching that barn camera to make sure nobody's born and then has to, wait on me to get to the barn or anything. So I try to prevent it in that way. And another thing is, obviously knowing your lambing dates, kidding dates, knowing when they're supposed to come can help. That way you don't get surprised and someone's born on a night when it's, -10. And then you've got to deal with hypothermia. But another good method to kind of warm up a lamb quickly, besides putting it under a heat lamp, you can take that lamb, and I have seen people put them in a grocery bag. You have to have warm water for this, but you put them in a grocery bag or something similar, so you don't wash all of its scent off. Because if you do that, then the ewe is going to say, well, that doesn't smell like me. Where did that come from? So you need to be careful about that, but you can submerge it in warm water. I recognize that's not always available at a barn, or even near a barn or out in a field. Another option you can do, and it's something that we've seen shared via various Facebook pages and other educational pages recently, is intraperitoneal injection of fluids, warm fluids. And that's something I would like to learn how to do, both as a sheep producer and an educator, to teach people. Because if you can get some warm, fluids in there, that will warm the lamb up even quicker. And the quicker you can get it warm, the quicker you can give it warm colostrum and help it kickstart its own physiological processes to get warm. I've seen people use hair dryers to get them warm. Whatever you do, it just needs to try to get it warm quickly and safely. You don't want to burn your barn down with, a heat lamp or something like that.
Yeah, I think sometimes it's hard to regulate the temperature on those lambs under a heat lamp that may be placed too low. And my daughter's helping in the lambing barn. They've burned a lot of jackets standing too close to heat lamps.
Oh, yes. Yep.
But besides that, I think that getting those lambs to overcome that hypothermia really helps them to kind of revitalize, and oftentimes enabling them to have a little bit more vigor and to get up and suck sometimes just requires us getting them warmed up. So having a thermometer on hand and checking those lambs, oftentimes by feel, you can tell whether they're cold or shivering, and getting them warm may oftentimes just be that first step in order to help them get onto the ewe.
Definitely.
One thing that we have done with kids that have come in with low temperatures, they're often dehydrated too, because they are cold, because they haven't been up nursing. And so something we do, it's not intraperitoneal, but we do take saline fluid. You can get it from your veterinarian usually, and you can warm that up to about, we go to about 98 to 100. I don't want it like full body temperature when we put it in them. But we'll take, 30 cc's and put a little bolus on their back, just under the skin, just like giving a subcutaneous injection, but you're just kind of making a little bolus of fluid. And you'll be surprised how quick their body will absorb that, especially if they're really dehydrated. And so, for like a 10-pound kid, we might give them 30 cc's every 20 minutes or so, and we just kind of watch as they absorb that. And you'll notice they'll start absorbing it slower the more that they're hydrating, and then their temperature will boost, sometimes like 5 degrees within an hour, just from those injections, and keeping them under like a heat lamp. Or we put we've got little milk heaters, so we'll put them in like a really closed off, like a box or something with one of those blowing in it. And that can get them warm fairly quickly, where they can, like you said, if you can get them warm and hydrated, they'll go out and they should be able to nurse again. So
definitely.
There's a question that I answered just by typing it out, because we kind of covered it, but it's shown back up again on utilizing cow colostrum or cow milk replacer for lambs. We've discussed this in some other webinars, and maybe you have some opinions on this, but we did briefly touch on it, on that staying species specific is generally the best way to go. The percentage of I'm sorry, I'm expounding a little bit on this, but the percentage of protein, fat content, and lactose between the three species of goats, cows, and sheep is pretty different between those. And also the size of the fat molecules is also different too. So it can be really difficult for lambs to even absorb some bovine or some cattle products. And so as far as we're concerned, the best option is generally to stay species specific. Do some people do it? Yeah, right. And they think that that's good. And but I think best case scenario is generally trying to stay within that species type. So, but
Definitely.
like Jesse said, what's available to you, right? So, so there's a question about, I think this is really important, on other than CD&T, do you recommend a vaccination program for young lambs? This can be a whole webinar in itself, and it has been. But can we get your thoughts on that, Jesse, and maybe Carmen?
Absolutely.
Afterwards?
Absolutely. So in our area here in Tennessee, I've done, lots of talks on vaccinations, and we are fortunate enough here at UT to have an extension veterinarian, and I work with a lot of the vets over at our vet school here at UT, and they all recommend CD&T, obviously, that a booster for the female, and then, the lamb or kid gets a booster as well, or gets an initial shot and then a booster. So definitely CD&T, because those are definitely easily preventable, right? We don't want a lamb to get tetanus because they'll die from tetanus. Any other things though that you might have, in our area, we have had some ewes have chlamydia basically, and we've had some producers have to start vaccinating for it. So I guess the biggest thing would be to have a relationship with a veterinarian or someone around you that's knowledgeable. Maybe it's your extension educator or whatever that can help you decide what to vaccinate for. But another thing, I don't know if you guys offer this in your states or your vet schools do. At Tennessee, we've got 3 different necropsy states sites across the state. So if you get abortions spontaneously or dead animals, you can bring them to UTCVM or our state lab in Middle Tennessee, or there's one out in West Tennessee, and you can figure out what's causing those abortions. Obviously, if you start getting several abortions, you want to get that checked out. And if they're due to Campylobacter, then I definitely recommend you vaccinating for that. And I tell cattle people too, there's lots of vaccines out there, but you only need to give what you need on your operation. We don't want to do 15 different injections on baby lambs or kids, right? But definitely CD&T, and then others as appropriate to your area. I'm not sure what diseases might be common out where you guys are, but like I mentioned, Campylobacter, chlamydia, those things can pop up around here in Tennessee. Not frequently, but they pop up enough for me to mention them in most of my talks about this. But then figuring out if you are having abortions and whatnot, or dead animals, figuring out why that's happening, and trying to go towards that prevention strategy.
Thank you, Jesse. Did you want to add on that, Carmen?
I think she covered it really well. Just always do CD&T, and then if you start having issues, look into the others. I know our state, not to my knowledge do we have the necropsy option, but our Wool Growers Association does have a few of those vaccines that are created every year for certain diseases. I'm not into the details of all of that, but I do know that that's an option for members of the Idaho wool growers. And then, just work with your veterinarian on what you're seeing in your own herd.
Right. So there are a couple questions on size of lamb again, but also feeding the ewe and how that may affect the size of the lamb. But more specifically, maybe talk about some risks of ketosis or milk fever. And then how would we combat that? and then also how that may affect how size of lambs may be affected in reference to that.
Definitely. So that's something, and here in Tennessee, we've had a lot of discussion about that, because a big part of our industry is selling show lambs to 4-H and FFA kids. And the breeders are, they're chasing those trends, right? Where you are going to end up with some big lambs. So part of it's genetics. And then part of it is keeping a close eye on how much you're feeding those ewes in late gestation and does. If you're really pouring the feed to them, they're already in a body condition score of 3, they're pretty good. They don't need 3 to 4 to 5 pounds of grain per day in late gestation. Now, when they actually kid or lamb and then start to lactate, sure, they're going to need more. But once you get up to that point and you start feeding them a lot more, that fetus is growing a lot during that third trimester, if you will. And when you do feed them too much, you are adding to lamb weight essentially, and they could be born, at an undesirable size for your ewes or your does, and they're going to be hard to get out. So part of it's genetics. Yes, you can overfeed there towards the end.
Jesse, you still there? Carmen, did we lose Jesse?
I can see her, but she looks frozen.
Yeah. For those of you who are still listening, it looks like we may have temporarily lost Jesse. I believe she'll probably log back in.
Oh, there she is.
Sorry about that. I must have gotten kicked off. But can you hear me now, Chad?
Yes, we can. Thank you.
Very good. Sorry about that. I'm not sure what our campus internet is doing. But ketosis, I think, is more of a problem than we realize, because if you haven't seen it before, it can be, misdiagnosed or something like that. But the key to that is feeding to their body condition. So if you already have over-conditioned ewes, you need to be really watching them and making sure that they're not, you don't want to get them to that point to begin with, but you also want to be careful about how you manage them. You don't want to starve them because they need energy there in that last trimester. But it's important to recognize early signs of ketosis. When they get down and can't get up, they don't have the energy to get back up, that can sometimes spell disaster. And if you can't induce, birth or parturition pretty quickly, you could lose everybody in that case.
Okay. So we had this scheduled out to around 11 or 1:30, right, Carmen? So I don't think we're gonna get through all the questions, and I apologize if you've had a question up and you've wanted us to get to it. We've been trying to prioritize what is most common throughout, that also is relevant to our guest speaker today. But there was a question around colostrum again with teats size. You want to speak to maybe some issues around supernumerary teats, and also if there's something we can do with that, and then what do we do if our ewes just have very small udders, or how much colostrum do we know to take from them in order to give to other lambs?
Yeah, so with extra teats, if they're, in my experience, if they're not functional, if they're, you don't get milk out of them or anything like that, they're normally pretty harmless. Other than if they are functional, they could be another entry point for bacteria, right? Because they're not getting used a lot, and they might need to be removed. I know in dairy cattle, we try to remove those early, remove extra teats. I don't see it a lot in sheep and goats, at least here in Tennessee. The question about how much to remove. So I kind of know from experience, and my husband, he helps me with all the record keeping and stuff. We know if a ewe is going to produce a lot of colostrum, but that can vary from year to year. I have one ewe, I know she's going to produce a ton. She usually has a big single, and I know I can take, 6, 8, 10 ounces from her and she'll be fine. You want to make sure though, like if you've got a ewe with a 16-pound lamb, it needs, 10% of its body weight. So you don't want to empty out both sides of her udder and essentially steal that from that lamb. So the other lamb, if you can at least give it 4 ounces of, colostrum from that ewe, that's amazing compared to what it was going to get to begin with. I would not try to steal, 16 ounces from one ewe or doe to give it to another one, another lamb, if she had a lamb on her. So it's hard to tell how much is too much or anything like that. But if I'm afraid that she's not going to have enough, I barely get any out, I'm not going to take any from that ewe because she's not going to produce more, right? So unless she has an abundance right from the beginning, I'm not going to, sit there and rob all of it from her lamb. I think I answered all of that, Chad. I'm not sure.
Yeah, I'll do a couple of these questions because there's been a few that are, so I think we'll do one more question on colostrum, and then I do want to move to this dystocia question about having the head back, because I've had a lot of people have that issue, and I think there is some advice that I can talk about that from our personal experience. But the last colostrum question I want to answer is, a couple people have asked, how much can you take from a ewe or a doe that has colostrum to freeze, I believe is the question. And I'll say my rule of thumb is I let her kids nurse for 8 hours. I will milk out about half of what she has, and then I will let them have the rest of it. And then after 24 hours, I'll milk her out again, as long as she's a heavy milker. If she doesn't have a lot, then I don't mess around with her, and I just wait for one that's going to have more milk.
That's a good rule of thumb there.
Yeah, because I always feel like I should let her kids have the first good amount, and then I just try and make her comfortable. But I think that there's a few people that asked that. And then the other question I wanted to talk about was we had a question, can you address the technique of manipulation to get a head back that only the neck can be reached during the birthing process? We recently have had this happen. I think my first piece of advice would be, don't stress out. It doesn't mean that the kid or lamb is going to be dead. We have been successful in getting that head up with a live kid, and everybody else was alive. So don't think they're going to be dead, because I know a lot of people are like, oh my gosh, I just have to get this one out because it's going to kill everything else in here. And that's not true. So stay calm. If you can, get someone to help you keep the female standing. In most cases, sometimes for us, it's been better that they're standing, because then you have more room to reach down to pull the head up. If they're laying down, it's all like squished. It's like a balloon that's like squished, right? But if they're standing, you have a lot more room to manipulate things. There is a tool you can purchase. It's like it's a tube, and then it has some like braided metal rope. I don't know what the technical term is, but it has kind of like a rope on it on the end, and you can use that as a noose to put behind their ears. You need to make sure you get it behind their ears, and then put the tube under their jaw. That way you're bringing the head up the way it should be. If you hook it any other way, it's just going to slip right off of them. And then you're also not causing any constriction of their esophagus, so that when they do come out, they can get a breath of air. And you still have to have the feet come first. So we usually try and pull their feet up into the birth canal after you get the noose around their head. If you don't have that noose, a couple of things that have worked for me, if you can, because what happens is they get their feet up there, and then they just get this signal to like turn their head, and it is like pulling teeth trying to get the head back up. Like it is really difficult. And so I feel for anybody that's had that happen. But you just have to kind of like, you do have to push the feet in. to get the head up, and then you, as best as you can, get all of it in there at one time. And that head is probably going to retract again. We've tried to use baling twine before we had this little tool that we bought. That didn't really work all that well, because it's really hard to get it around their head and get it tight, which is why this tool I'm hoping is going to work. We haven't had to use it yet. Hopefully, because we bought it, we don't have to use it ever again. But yeah, so I guess the point is it's difficult, but it's doable. And try and get them standing so you have more space, depending if it's a single or not. Because what I always feel is if there's, usually it's happened when there's multiples for some reason for us. But if they're standing, then you can get the rest of the body to kind of like drop down.
Mm-hmm.
Sometimes you can also get the head to come up if there's some bottom pressure. So just feel around, keep your hand in there as much as possible, because once you do come out, it's going to all follow you, because they usually have a lot of contractions.
Mm-hmm.
So don't pull your hand out unless you absolutely have to, because you're going to lose any progress you've made by doing that. So, but Jesse, if you have any advice as well.
Yeah, I agree with all that you've said, Carmen. Sometimes too, I'll take my thumb and finger and grab their lower jaw,
Yes.
kind of like a fish. And you got to be careful with that, because you can, you can grab them too hard, but really all you're grabbing is that jawbone, right? So you're not going to do too much damage. But I have grabbed that before and pulled it up. I have also taken my hand, if you can get it in there, you can take your hand and go behind their head and pull their ears, kind of like this. And then I make this kind of sweeping motion to get that head to come up and follow and be on my palm. Once you get it in that direction, though, like Carmen said, it's best to go ahead and get it out, because if you remove your hand and, that head's just going to do this and go back. Like she said, it's like they get a signal that says, throw your head back. Swim away from the cold that you're going out into. I don't know what it is, but it does seem to be a reflex, because everyone I've ever dealt with does that. They just bam, take that neck and glue it back.
Yeah, if you can't pull the head and the feet in the birth canal before pulling it's just gonna fall right.
And it will hurt your hand. I've had bruises on my hand, and it's all for the greater good, though, right? You're trying to get that lamb get out alive.
Yeah,
so,
and that's the
game.
I've had people call me like in tears, and the lamb's still alive, but they can't get it out, and they're like, it's gonna die and everything's gonna die and everything, and I'm like, it's not dead yet. Even if it is, you'll be fine. You'll get it. Just don't go tearing in there and causing more damage than you need. You can do it if you stay calm and feel for the right things. Yeah, and someone mentioned a hay bale under the belly works, and I've heard of that as well. To keep them standing if you're by yourself.
Definitely.
Well, I think we'll stop there for today. With the continuous flow of questions, it's hard to get to them. But I wanted to make it very clear to our listeners that if you guys do have questions, generally everyone who comes to this program is more than willing to answer questions. Jesse, I believe you'd be willing to take phone calls or any kind of emails to answer questions, along with myself, Carmen, and then also Melinda, Dr. Ellison, who frequents this program. Feel free to contact any of us, and we would be happy to talk about nutrition, reproduction, really all things sheep and goats. And if we don't know the answer, we'll find someone who does. So we appreciate all of you, and hope to have you on again next month. The second Wednesday of the month is when we have our webinars, and we should be getting out that program here in the next week or so. Okay. Well, thank you, Jesse. We really appreciated having you on today.
No problem. Thank you for having me. Besides me getting kicked off Zoom there at the end, I think it all went well. I don't know why that did it for me, but
Well, we all got kicked off at one point. So
Yeah.
yeah. Okay. Well, I believe we'll end this, and Carmen, you're in charge of that, I believe, right?
Sure.
So okay.
I think so. Awesome.
Thank